This is USVI News, your Virgin Islands connection.
Hi, everyone. Thanks for joining us for USVI News. I'm Emily Matson. We begin today with the very latest on the COVID-19 numbers right here in the territory. There's been a spike in cases over the past week with 81 new cases reported. St. Croix is seeing a big spike right now with 62 reported just since March 12th. Health leaders in the VI say the increase in cases is traced to larger gatherings. So again, there are 81 active positive cases of coronavirus in the VI with 62 in St. Croix and 19 in St. Thomas. Fortunately, leaders say they have not seen any more cases or any new cases at all of the more contagious variants pop up throughout the territory. The Virgin Islands is reporting the lowest mortality rate from COVID in the nation, and health leaders want to keep it that way. That's why on Friday they pleaded, even emotionally, for people to get vaccinated.
Unfortunately, we are still seeing new cases of COVID-19 across the territory, and the recent spike in new cases is alarming. The best prevention we have is the vaccine. We are now receiving the Pfizer, Moderna, and Janssen vaccines in the territory. By the end of today, we will have completed 3 weeks of vaccinations at the Community Vaccination Centers, or CVCs, on St. Croix and St. Thomas, and those efforts are going extremely well. Since opening on March 1st, we have administered 6,494 total vaccines at the CVCs alone. The territory is on track to meet or exceed the governor's goal of at least 50,000 vaccination shots provided by July 1st.
We would not give any sort of treatment that would not be beneficial. And honestly, it's just point blank right now. There is a virus, there's a vaccine. Vaccines prevent viruses from happening. Get the vaccine. So we are seeing now the effects of people who are not protected from the virus in St. Croix right now, okay? And it gives me chest pain and heartburn every night when I have to hear the more numbers and the more hospitalizations, the more management that we have to do to try to prevent people from dying. The last numbers show that we are about 12.5% in the community vaccinated or immunized. That means that we have a long way to go before we get to 75%. So unless everyone plays their part and gets vaccinated, this is not going to go away. And we're just going to continue to have more hospitalizations, more people are going to die, and that's just the reality. So everyone needs to start thinking about the reality. I'm tired. I'm going to say it point blank. I'm tired. And so is a lot of people on this team. Please get vaccinated.
Strong message from health leaders today. You can just hear the stress and emotion in her voice. Now, to meet Governor Albert Bryan Jr.'s goal of 50,000 vaccinations by July 1st, the VI Health Department is making more changes to try to make it easier for you to get that COVID-19 vaccine. Residents of St. John will soon have a chance to get easier access to the COVID-19 vaccine. The VI Department of Health is offering vaccinations to residents on St. John from 8 o'clock in the morning until noon every Saturday through the end of April. And that effort starts this Saturday, the 20th. It's going to be happening at the DeCastro Clinic in Cruz Bay. So this Saturday, the 20th, they have enough vaccines for 125 people on St. John to be vaccinated this Saturday. And at last check, there were still some appointments available. So in addition, the Community Vaccination Center on St. Thomas has extended its hours. It's now open from 8 a.m. to 7 p.m. Monday through Fridays at the Community Vaccination Center at the Sports and Fitness Complex at the University of the Virgin Islands. On St. Croix, the Community Vaccination Center is at UVI's Great Hall. Again, St. Croix is where they're seeing the spike right now, so health leaders are really encouraging people to get out and get that vaccine. Vaccinations are available to any resident 16 years old or older, and appointments can be scheduled through the Vitima hotline, which is 340-777-VAX or 8227, or you can go online. And that web address to do so is covid19usvi.com/vaccines. On St. Croix, the Arthur Richards K-8 school, which occupies a portion of the St. Croix Educational Complex High School campus as well, has returned to virtual learning for the time being, at least, after a non-instructional employee tested positive for COVID-19. The move back to virtual learning follows advice from the VI Department of Health to district and school leaders, saying the school should temporarily return to virtual learning. The school was notified of the positive test result back on Thursday, the 18th, and the employee was last on the school's campus on Wednesday, the 17th. Leaders say the employee fortunately did not have contact with any classrooms or areas in the actual physical learning environment. However, the campus is going to be thoroughly cleaned before reopening again for in-person instruction. Meantime, the CDC says students in schools can now sit as close as 3 feet apart. U.S. health officials are relaxing social distancing recommendations, at least for schools. New CDC guidelines signal a turn away from that 6-foot distancing recommendation. The 6-foot rule has forced some schools to remove desks, stagger scheduling, and take other steps to keep kids apart. So hopefully this new guideline will help schools throughout the nation. Again, they can now sit 3 feet apart instead of 6 feet. This does not, however, translate to the general public. This is just for schools, at least at this point in time, from the CDC. Well, more than 73 million Americans have received at least the first dose of the coronavirus vaccine, as VI leaders plead for everybody in the territory over the age of 16 to get the vaccines. We wanted to let you know what you should do or should not do when it's time to roll up your sleeve.
As more shots go in more arms,
There's an end in sight.
I feel like, the future is definitely more hopeful.
the more questions people have about what to do and not do when it's their turn.
People are very excited about that and how they can participate and help accelerate and move that forward.
Northwestern Medical Center infectious disease specialist Dr. Irfan Hafez says if you're worried about an allergic reaction, talk to your doctor. But don't take or increase allergy medications, as they're unlikely to prevent anything.
In general, the allergic reactions are rare. We now know it's about 2.5 cases per million people vaccinated.
The CDC says you can take ibuprofen and Tylenol after vaccination to relieve any side effects you may experience.
Most people are noticing this after the second dose.
Alcohol or exercise in moderation are unlikely to affect the immune response. Something that may be impacted, though, mammograms. The vaccine can cause lymph nodes to swell temporarily, which could show up on imaging exams.
It may be important to make your physician aware of that. So either get the imaging done before vaccination or about a month after that.
As for which vaccine you should get, any of them, says Dr. Hafez.
Please do take the first available vaccine that you can get.
Shots of hope as vaccine distribution expands.
Well, while it may not be necessary, Dr. Hafez also says it's a good idea to plan on taking it easy the day after getting the vaccine, especially following the second dose of the 2-dose vaccine, because that tends to sometimes, in some people, cause more severe side effects, or worse side effects than the first shot. Well, the Transportation Security Administration, better known as the TSA, wants to hire 6,000 airport screeners by summer. The agency says COVID vaccinations are projected to lead to an increase in travel, meaning there's a need for the additional full and part-time employees. And summer is the busiest time of the year for airlines and those TSA screeners. The agency screened an average of 913,000 people a day over the past week at U.S. airports. That's still 40% of the number that flew in the same period last year, or a year earlier. The agency's recruiting new employees for approximately 430 airports nationwide.